All right, as you've probably guessed from the title of this video, I'm going to be talking about my partial molar pregnancy experience and my experience with a D&C. If you're here, I'm sorry. Probably means that you're going through this yourself or you know somebody who is, and it's not a fun experience whatsoever. And I just want to caveat, I'm not a doctor. I'm just sharing my own experience here because when I was going through this, there wasn't a ton of information out there. I like hearing other people's stories and especially the data and sort of science behind it. And I really struggled to find a lot of that content. So I'm not really a YouTube person. This isn't my thing, not super comfortable with it. But I felt like I really wanted to make this to help some other women that might be going through the same thing. So just know this is my own story. Anything I say here, make sure you're consulting your own doctors and your teams to make the best decisions for you because everybody's experience is different. So I also have notes. You're going to see me looking down because I want to make sure that I get my data accurate and sort of my timeline of things accurate. When I was going through my partial molar pregnancy experience, I was always wanting numbers and to hear what everybody else's progression was. So I want to make sure that I provide that today. This pregnancy was pretty rough for me for the start. We had a previous miscarriage about a month and a half prior. So we were asked to, wait until my cycle came back completely and things looked regular, which we did. And after one cycle, we decided to try and get pregnant again. So we were very surprised. The very first cycle, we found ourselves pregnant. So I think it was November 4th was when I took a pregnancy test and it came back positive. So we were really excited, but coming off of a previous miscarriage, you're sort of cautiously optimistic about it. And things were pretty rough from the start for me. So initially I started with a UTI, which is never fun. And on November 2nd, before I even knew that I was pregnant, I had to go to urgent care for that UTI to get antibiotics. So, I thought I could be pregnant, so I made sure to tell them that. And they put me on an antibiotic that they said was safe in this scenario. So I felt confident about that. I also checked with my OB and they said that that was okay as well. So November 2nd was put on antibiotics. November 4th, I wasn't really planning to take a pregnancy test, but I had a dentist appointment. And before they x-rayed me, I just wanted to be sure that, there wasn't a chance that I was pregnant. So I did a test and was pretty surprised to see that it came back positive. So at this point, we were excited, but because of the previous miscarriage, that puts my sort of track on the early checks, just to make sure that we were okay with our OB. So they got me set up to have my HCG levels checked pretty early. And for those of you not familiar, that's the pregnancy hormone. That's the hormone that says pregnancy is progressing as it should, essentially. So November 5th, I had my first sort of HCG draw, and that came back at 65. So that number was, pretty indicative of an early pregnancy. And then they would check that again in 2 days, so about 48 hours to make sure that that level doubled. I guess that's what they typically like to see in early pregnancy to make sure that, the pregnancy is progressing like it should. So then again, on November 7th, my HCG was checked and it came back at 160. So at this point, we were excited. That was a good indicator. It felt like the numbers were moving in the right direction. So we were, starting to let ourselves get more confident in this pregnancy. At the same time, with my first miscarriage, I experienced some spotting pretty early on. I think week maybe 6 is when we started having spotting. So I was also really looking out for that because that to me was an indication that, maybe something wasn't right. And I did not have any spotting with my partial molar pregnancy, which, was sort of tough in that it lets you think that everything was just okay and you felt pretty confident in things when in reality it didn't go so smoothly. So November 18th, I was still trying to kick this UTI. It was sort of lingering around, and then I got a sinus infection that started. So I really felt like my body's immune system was struggling and it was going into defense mode, and I felt just really crappy all around this full pregnancy. So my main doctor then prescribed me amoxicillin. I also let her know, hey, I'm pregnant, I need something that's safe for that. So she said it was totally safe and that it was, much better to kick whatever was happening in my immune system than let that potentially progress and get even worse and, then endanger myself and the baby. So that was around November 18th. And then I was scheduled for a 6-week scan on November 22nd. And again, that's not normal. You don't usually have scans that early, but this was because of my prior loss. So from our first ultrasound experience with our first pregnancy, we learned that the tech can't say much. They can really say, hey, it's there, things look good. But if things look not so great, they're usually not allowed to give you a diagnosis or anything of the sort. So our tech was quiet for a while when we went in for that 6-week scan, and that was November 22nd, which was a bit concerning. So, you never like to hear silence. You want to hear them say, oh, we see something, or things look good. And she said it looked a bit irregular. So at that point, we're starting to panic. We're not feeling super confident about things. But she also said, hey, it's still early. We might see development again in a week. So she said that she saw a sac, but no fetal pole. So I guess at that point, you're supposed to see, some indication of the actual fetus itself. She also mentioned that my dates might be wrong. And I am somebody that, I was logging my ovulation. I'm looking at my dates. I'm pretty regular. So I knew that probably wasn't the case. We were pretty confident in our dates. So deep down, that concerned me. She's, the tech was all, oh, women mess up their dates all the time. You'd be surprised. But I just really didn't feel like that was the case for me. So at that point, they sent me for more blood work. They wanted to see where my HCG levels were at that point to see how things were progressing. So we were pretty nervous. I would say not very optimistic at this point. But we went ahead, did the blood work, and my levels came back at 12,775. So, by normal pregnancy standards, that number looked really strong. It looked like that's what you want to see in a pregnancy. The hormones are continuing to rise. So, that was November 22nd. We have Thanksgiving in between that and when our next check would be, because they wanted to check me again in a week and do an ultrasound. So that was really hard. We, are spending time with family. At this point, we hadn't told anybody, and we're just sort of in our minds praying that we see something the next week, but at the same time, not trying to keep our hopes up. So going through this all during the holidays just adds sort of another dynamic that's really tough, because you want it to be a, happy, cheery time of year, and we were extremely stressed with all of this, so not very fun. So at our 7-week scan, this was December 1st at this point, there was still no fetal pole visible. And at that point, we knew it wasn't right. We knew this wasn't a viable pregnancy. We would have seen something. But we didn't know how wrong it was. So we, you're always doing the Googling and the WebMDing and trying to figure out what's wrong. So my husband and I were like, maybe it's a blighted ovum, where it's just, something doesn't form right from the beginning, and there's, something else wrong that hopefully would just quickly fix itself, and then we could try again. So they did my HCG again on December 1st, and that came back at 36,471. So pretty high. And at that time, I think I didn't really fully know what this meant. I didn't understand that, if your HCG is continuing to rise, but maybe something doesn't look right on the ultrasound, that could be pretty problematic. So for us, it was pretty weird. We had our ultrasound on December 1st and that blood draw, but we didn't actually meet with our OB until December 2nd. So that had been like a previously scheduled regular check-in with her, and they just left that date on the calendar. So that was tough, hearing from the tech that things don't look good and something's not right, but we didn't know what, and you have to kind of wait for that 24 hours to actually, meet with the doctor and go through all the options. So that was really, really hard. You're just kind of wondering what's wrong. But at that point, we did go ahead and we called both of our parents and told them, hey, we were pregnant. Things don't look good. We're pretty sure that this isn't going to continue. So that's, again, really hard to not tell family members. And the first time that you have to tell them is, this is what was supposed to be great news is really bad news. So tough, very tough. So then we met with our doctor on December 2nd, and she started explaining to us what she was seeing in the ultrasound pictures. And normally, you see a sac, you see a fetal pole, everything looks pretty normal. And what she described ours as was sort of Swiss cheese. There were these sort of holes like all around on the ultrasound screen that weren't supposed to be there. And to her, she was really concerned that this might mean it's a molar pregnancy, which I had never heard of before. I had no clue what that was. And she said, she explained it was very rare. You don't see it super often, but she said it was something that all doctors are taught to look out for because you need to move fast when you do find it. That's when the conversation, I think, got a little more scary than we were anticipating. She went into details on exactly what a molar pregnancy is. And she sort of explained that there are two paths. So one is, a egg is missing genetic information and it gets fertilized. So that is a complete molar pregnancy. And the second is egg maybe has genetic information but gets fertilized by two sperm at the same time, which biologically I had no clue that could be a thing. But essentially in both of those scenarios, DNA is imbalanced, and that can cause, I think it's called trophoblastic tissue, to start replicating and creating tissue, which is emitting those HCG hormones, which causes your rates to rise really quickly. So, it's not a fetus, it's not viable, but it is building and growing within the uterus. So that was really interesting. And I will link to some other videos that I watched that were, very scientific and explain the full spectrum of things and all of the science behind it, because I was watching those like crazy. I like to know as much data as possible about any scenario. So at this point she was saying, hey, it might be a molar pregnancy, but we really have no way of knowing until we get DNA to see, what the nuclei look like and see what we see in terms of the chromosomal formation. So she did also explain that she was going to push us to have a D&C because they needed to collect that tissue, and also because there was some risk with me if they waited for me to try and see if my body would naturally pass it. She said sometimes that doesn't happen because my body, still thinks I'm pregnant. It wants to keep it. But there was also, risk in terms of bleeding and hemorrhaging that you just really don't want to go through. So at this point, we at least sort of knew what we were facing. She told us that she would be the one doing my D&C, which provided me a lot of comfort. I really trust her, and she's been an excellent OB for me to date. So that was a little bit helpful. The other thing I will mention is that I discovered there's a molar pregnancy support group on Facebook, and that community of women is just fantastic. It's so many other women that are either going through this experience, have gone through this experience, and you can post any question you've got in that Facebook group and you're going to get an answer from at least one, if not 5 to 10 women supporting you. So highly recommend that. There's also ways to get in that group and post as a guest if you're not comfortable maybe with your profile being shared, or you don't want your name out there. You can post anonymously. I will also add that it's a private group, it's protected, and you have to answer some questions about yourself to even gain access to it. So they've done a really great job of keeping that as a safe space and a private community for women to get help and ask sensitive questions during a really tough time. Make sure you do watch out though. There's 2 different groups. There's one that's a my molar pregnancy group, and then there's one that's after my molar pregnancy. So the after one is for women that are trying to conceive again, that are maybe pregnant again and have questions around that. So would recommend starting in the normal molar pregnancy group, because the other one can be pretty triggering if you're still actively going through all of this. So at that point, we were set up for a D&C, which, pretty nervous about from the get-go. I had never had one. My first miscarriage was a natural one. So my body sort of did what it needed to do, and I thankfully didn't have to go into any sort of surgery. So we were scheduled for December 7th for our D&C. Something to call out is that most people we encountered called this a D&C, especially in like scheduling with the hospital. But what I later learned, and maybe my doctor told me this up front and I just, didn't process it with all of the things happening, was that this was actually a dilation and suction, not the curettage piece. And I might be saying that totally wrong. But the C really stands for curettage, where they are actually like scraping your lining. Whereas the first D&C for me was just a D and E, I think is maybe what they call it, evacuation. It was just suction. They weren't scraping. So the reason that they do that obviously is to try and take the most conservative approach, has much less risk with it. You're still always at risk for, potentially bleeding out or having all sorts of issues. So that's why they went that way with the first D&C for me. If you're not sure, probably worth asking your doctor. D&C is a little bit more intense than just the actual one with suction. So I would make sure you clarify on that if you can. In terms of the D&C itself, I was extremely nervous for this. I'd been put under before for other medical procedures, but this was different. This was a little bit more scary. And I should also mention that, my doctor did mention that sometimes molar pregnancies can lead to cancer. And that was why there was some urgency around this. So, whenever you hear that, it's absolutely terrifying. But I knew that this was what needed to be done. So I was watching a lot of videos on other women's experiences, on what happened at the hospital, what their recovery was like, because I just had no clue what to expect. A lot of women don't talk about this, and I had no other person in my life that I knew that had been through it. So we were scheduled for December 7th. They give you a call the day before, typically, the hospital will, and they will tell you what you need to do. So my doctor, said that I needed to wash with Hibiclens, which was an antibacterial skin cleanser. You just wash your entire body with that before your surgery the night before, or if you're a morning person, the morning before. And the goal of that is to, make sure there's no bacteria that could cause infection or harm during the actual surgery. So it didn't smell great, especially being pregnant and very sensitive to smells of all sorts. I did not enjoy that. So if you can be in like a more aerated space or leave the door open while you're showering or something, I highly recommend that. We also didn't learn the time of our D&C until the day before, which I'm a planner and that drove me a little bit crazy. I think we ended up being scheduled for 2 p.m. was the time that I was supposed to go back into surgery. And they told me that the day ahead. And they also said that I couldn't eat for 8 hours ahead of surgery. And my big concern at this point was, my pregnancy hormones are through the roof and I'm very nauseous. So I was really concerned about being so sick not having eaten before the D&C. So I think it was like, I set my alarm for maybe 5 or 6 a.m. the morning of my surgery and just ate a bowl of Cheerios just to get something in my body and something that was fairly basic. And I'm so glad I did that because there actually ended up being a little bit of a delay. I think the OR was behind on schedule, and they also forgot that they needed to do one last ultrasound on me before I went back. So I think I ended up not going back until 4 p.m. And by that point, I was so nauseous. Had I not done the Cheerios, I think I probably would have been, gagging and not in a great space. So really glad that I did that. I will say the nurse kind of questioned me a little bit about it. She, they take all of your information when you come in and they try to get your medical history and everything you've done. And they said, have you eaten anything today? And I said, yeah, a bowl of Cheerios at 5 a.m. And she was like, well, did anybody tell you you could do that? And I told her that, on the phone when I talked to them, they told me that 8 hours before was the cutoff time for eating. So she just sort of brushed over it and, didn't say anything farther. I think their main concern is, if you're in surgery, they don't want you throwing up and potentially blocking your airways, but I didn't have any issues with that. So just wanted to mention that part in case anybody else was really worried about being nauseous. So December 7th, they took my levels again before my surgery, and at this point they were at 67,180. So this is why I was feeling so bad. My levels were just exponentially increasing as that tissue was pretty rapidly growing. Some other things to know about the day of. So obviously you'll have an IV put in. For me, this part was pretty painful. I think I probably should have hydrated a little bit better the day before. I also have really tiny veins and they always have issues getting them. So highly recommend that you drink a lot of water. You do have to cut that off at a certain point. I think that was maybe 6 or 4 hours before surgery. Food was 8 and then water was a little later. So just make sure you hydrate. And then there's a lot of paperwork. Especially with a molar pregnancy, unfortunately. So I had to sign a lot of papers around the fetal tissue and what happens with that products of conception. So you have to give medical waivers for that to be disposed of. My doctor talked me through all of that, and she was, of course, like, I'm so sorry that you even have to do this. They will ask you, like, do you want to keep the tissue? What do you want to do with it? We had absolutely no use for that, and I just wanted it all tested and taken away. So just know that you'll have to sign paperwork around that. And then I also had one last ultrasound just to check how everything looked, make sure nothing was overlooked, and that they properly made the right decision. So that's what ended up delaying me a little bit. I think when they scheduled my D&C, somebody missed scheduling that ultrasound that had to happen right beforehand. So that was why I was a little bit delayed and didn't end up going into the OR until like 3 or 4 p.m. So yeah, at this point I had a lot of nausea, especially getting like wheeled to that ultrasound because I already had my IV in, wasn't super mobile. And I was just like closing my eyes a lot, trying to breathe deeply. Then you have the, anxiety on top of that of just waiting to go back. So that was really rough. I also have really bad eyesight. I have to wear glasses. They make you not have jewelry or contacts in or anything like that when you have surgery. And so I requested that my glasses get to stay on me until I made it all the way back to the OR. I was really worried about nausea, and if I didn't have my glasses on, the world is fuzzy and everything looks really rough. So they honored that, which was really nice. They kept my glasses on, and then somebody whisked them away once I was ready to be put under. What else is there worth mentioning? At this period, they were still mandating masks for all patients at the hospital. That also made my nausea a lot worse, but when nurses left the room, I was taking my mask off to try and breathe a little bit better because that was just really rough. And for this D&C, I think it's important to note that I was not intubated. I believe I had just some sort of like airway mask on when they put me under. And if you are intubated, that is a lot more intense. I did end up having a second D&C, and I'll probably make a separate video about that because that one did quite a number on me, and I think it's worth talking about the differences between the two surgeries. I went under. I don't think I was out for all that long. It was, I think, a pretty quick procedure, maybe 30 minutes max. And then the doctor reported to my husband and my mother-in-law once I was out. I was still sleepy and totally out, and she gave them the download on how everything went. So at that point, when I woke up, it was just a nurse that was back there. No family was with me. And I actually didn't feel too bad. I was really worried about feeling really nauseous coming out of surgery just because of all the hormones and everything. So like the first thing I asked for was a ginger ale, just to make sure that, my stomach was good. So the nurse was really sweet, got me that. At this point, I maybe had a little bit of cramping while I was laying there, but not too bad. And things were like pretty dark. They kept the room, comfortable and calming. So I had my ginger ale, and then I nearly immediately had to pee. So they have the IV in you and you are overhydrated at that point. So I did ask the nurse if, I could go to the restroom, and she was like, do you feel comfortable getting up? Do you feel like you're stable enough? To which I said yes. I felt good about that. So she helped me get to the restroom and use the restroom, which was nice. And then I think at that point, she called my family back. So my husband was able to come sit with me, and that really wasn't too long. I think it was maybe 15, 20 minutes that I was sort of back there without my family before they brought them in. Overall, the recovery was pretty straightforward. I ate food that night just to make sure that I got stuff in my stomach. I kept it easy with like a smoothie and a sandwich. and I didn't bleed a ton. I think that's worth noting. I was expecting after a DNC that, there would be a lot of blood, and there really wasn't. My doctor also said that seemed a little odd to her when she was actually in there. She said I wasn't bleeding a whole lot, and she said that was atypical to the molars that she had seen previously. So at that point, I was thinking, maybe it wasn't a molar pregnancy. I don't know what it would have been if it wasn't molar, but that was just something going on in the back of my mind. One other thing I want to mention, if you have a sensitive digestive system and you haven't been under anesthesia, sometimes it can mess with you a little bit. So maybe TMI for some of you, but I like to share it because I wish I would have known. I was constipated for probably like the first 2 days after my DNC, and then I ate a large meal and it was not good. So just make sure that you're preparing yourself. If you're someone that easily gets constipated, maybe take some medication or something to help smooth your body out, or make sure that you're doing like probiotics or something of the sort. So at that point, we had the DNC. We really wouldn't know results of if it was 100% a molar pregnancy until we got the DNA analysis. They also send the tissue off for pathology, and basically my doctor said we don't really care what the pathology says. That's just a check to make sure that I guess it hasn't progressed to cancer at this point. What we really cared about was the DNA analysis. So I think I'm trying to remember what day we got our analysis back. It was at least, I feel like, a week from the actual surgery. I think it was roughly a week. So I'm going to read this because there's a lot of medical jargon here, but it was a DNA ploidy FISH analysis. It's capital FISH. And our results came back that there was a double trisomic signal pattern present in 26 of the 50 nuclei. So this was about 52% of the cells, and the normal cutoff is 9%. So that double trisomic pattern is basically saying there are duplicate chromosomes for things, which indicates that 2 sperm hit the egg at the same time. The presence of a double trisomic signal pattern for chromosomes 1 and 11 is strong presumptive evidence for triploidy in the specimen. This finding is associated clinically with partial hydatidiform molar gestation. I don't know, look it up, figure out how to say it. But histopathic correlation is required. So that basically said this was a partial molar pregnancy based on the chromosomal analysis. So at that point, I was a little bit relieved, because when you think about molar versus partial molar, for some reason medically, complete molars more often progress to cancerous. Now again, it's still very small percentage, very rare, but that percent is higher with a complete molar pregnancy. So hearing that it was a partial molar gave us, some sense of relief, if anything. But at this point, we were told, hey, we're going to watch your HCG levels all the way down until they hit 0, because that monitoring is key to make sure that the tissue is completely gone and that it isn't continuing to try and, replicate and build up and potentially, spawn off into something that could be cancerous. So normally, your levels drop. I would say I've seen, based on the Facebook group, some women take a month, some women take 3 months. It's really sort of across the board. But then eventually you are cleared to try to conceive again, and there are different scenarios dependent on what kind of molar pregnancy you had. Sometimes you're asked to wait to conceive for 3 to 6 months. Sometimes it's a year if you require treatment. So absolutely talk to your doctor about that. I'm going to end this video here because for me, my levels did not naturally drop like they should have. My first week check looked good, and then my second week check, my HCG levels started rising again, which wasn't what we wanted to see them do. So I will make a separate video about having a second DNC. Unfortunately, that's the route that we ended up having to go, but for most people, 1 DNC usually knocks it out. So just wanted to share all of this information to, give you some sort of expectations on what to expect and some resources that you might be able to use. But I will make a second video talking about the rest of my experience that hopefully not too many of you have to go through, but in case you do, I want to make sure that you have a resource that you can look at. Thanks.